How can I get a diagnosis without it being placed on my child's medical record? I want to find out what processes I can help with that won't give her a label she is fearful of. So, since ADHD is a biologically based disorder, it will go on her record. Um, Obviously, if you're a pediatrician diagnosed your daughter, that's part of how it will go on her record. But you could see a mental health practitioner privately and have an assessment and then keep it off of the medical record. If you're talking about a school record, of course, that's up to you what you plan to disclose. I just want to say hi to Cindy from Cape Town. Wow, fabulous. And Kim from Ireland. Hello, everyone. My son is 13, and he has ADHD and ODD, oppositional defiant disorder. Any tips on how to handle his anger? He is very angry and frequently screams at us and his siblings for annoying him when we are doing normal daily things like talking, chewing, laughing, etc. He often says he hates us and never wants to see us again once he is 18. It is heartbreaking, and I have no idea how to handle this. Okay, so the first thing I want to say is to all of you who are parents of adolescents, um, buckle up. And the job of adolescents is to ask themselves, who am I and where do I belong? And that process of figuring out the answer to those questions is to push up against known people in their lives, particularly family members. Now, while I think a lot of kids with ADHD can be aggressive and reactive and sometimes hostile, have additional hostility than we might see in kids without ADHD. For me, I see ODD as a diagnosis that indicates there are problems in relationships. There's problems in how parents are dealing with a child or how a child is receiving contact at school. And so we want to see ODD as a red flag rather than another label. Oftentimes what happens is kids who have ADHD and ODD, when they are properly medicated and in family therapy or parent training, after about 2 years, the ODD symptoms subside. For this person who talked about their son screaming at them for doing annoying things, this child is also, it seems like he's on the autism spectrum. And so a lot of times for these kids, they're very sensitive to sound and noise. They have trouble receiving cues, facial cues, understanding social interactions. And so he's telling you he doesn't want to see you again when he's 18 because he's angry, not just at you, but he's angry at himself, that he can't process in a way that he would like to be able to do in the world around him. So I think the main thing with adolescence is that we want to remember to put on our Teflon suits. And a Teflon suit is when the kids will say things to you, but you don't react. You respond in a way that reflects back what you hear, but you don't get triggered. I hear that my talking is bothering you. I understand that, but we talk in this family. Would you like us to adjust the volume? Because maybe it's the talking, maybe it's the volume. People are chewing. What he's saying is that he can't process the difference between the foreground and the background. All the noises are intrusive and triggering for him. Maybe he would do better with some of those little rubber earplugs. I would encourage you to work with a family therapist or your primary care provider to come up with some solutions, both medically and therapeutically, that would reduce his sensitivity. Okay, I'm going to go back to greet a few more people. Fatima, oh, you are from the French-speaking side. That's great. Shireen from Australia. Good day. Annalise from Baltimore. Kathy, I hope I answered your question. Jennifer, Az from Norway. Wow, thank you. Aze, maybe? I'm not sure how to say it. Eric has a question. How do you convince a young adult who just wants to be normal and not a person with disabilities? Well, this is a great question. Erica, excuse me, I'm sorry. So here's the thing. What is normal? There's a wide range of normal. To me, there's typical behavior and there's atypical behavior. And I think that's really important because feeling abnormal is a terrible feeling for anybody. And so what your young adult is saying is, I want to be like everybody else. I don't want to have these struggles anymore. I'm frustrated. And instead, what we want to do is try to help people accept the brains they have, the strengths and the challenges. And in order to do that, we have to identify the strengths. What are some things that this young adult is good at? That this person enjoys. A lot of times it's hard to appreciate what we do best because it's easy for us. And yet that's so important, particularly for people who live with ADHD, who have often received many negative comments about the ways that they've missed the mark or they're not measuring up. The other thing that I want to say is that, I want to share a comment from a person I worked with, a young girl. She was maybe in third grade, and she often felt, excluded. She struggled socially, and but she had a pretty great attitude. And she said, "Dr. Sharon, I am an outside the box thinker. I have a few friends who are outside the box thinkers too. And you know what? We're a group because who wants to be inside the box anyway? It's just boring in there." I love this because what she's doing is she's turning this conversation that could be about why she's weird or different in a negative way into something positive. So let's identify what we're good at. This helps us foster a growth mindset. We call these islands of competency, things we like to do that we're good at, and we're going to nurture those so those become more of a focus of our lives than what we struggle with. Danielle, you're asking a question about how to handle continuous physical violence. I assume that's from a child. If you could be more specific, that would be helpful to me. And Annalise says, my daughter with ADHD and anxiety is too anxious to meet with a therapist, even though it's not in person right now. How can I help her ease into this much needed mental health help? Well, that's a great question, Annalise. I do believe that right now, kids who are anxious with ADHD can benefit from mental health and that therapy is effective. Particularly, some therapists might be having an initial consultation in the park, some may not, but it might ease the burden if you are also on the call or in the session. And so while some therapists are using software where everybody has to be on the same screen, I would encourage you to ask the therapist if you could use Zoom so that your daughter is in wherever she is on Zoom and you're wherever you are. So there's some separation, but there's also togetherness. That might help facilitate conversation, but it gives her space to be on her own. So let's see. Is there any relationship between inattentive ADHD and dyscalculia? Well, of course, approximately 70% of kids with ADHD have learning disabilities, and dyscalculia is one of them. But there's not a cause and effect. It just can happen for some kids and not for others. Since ADHD is neurological and related to the amount of dopamine transmitted, can many of our kids' challenging attitudes be considered involuntary? And if so, what would be the tools to treat that involuntary behavior? That's a terrific question. So here's the thing. There are, we have about, 11 executive functioning skills that have been that we can categorize into smaller groups. But of these 11 skills, some of them are hot skills. They're things we're conscious of, whether it's impulse control, emotional control, being able to be organized or plan something. Then there are the unconscious skills, the cool skills, things that we're less aware of, how we're sustaining our attention, how a working memory is pulling up information for us, how we're judging ourselves while we're in activities. Are we evaluating ourselves accurately? And so what we want to do is to address the biological component, hopefully with some medication, not because medication will cure all of these challenges, but medication will facilitate the process of learning the necessary skills. And in some cases, medication can help kids attend more regularly, or that the intensity of their emotions is somewhat less. So I think we want to do a marriage of both. And so the tools to treat these involuntary behaviors would be um, would be a combination of treatment, which is of course what's most recommended. Um, Danielle, she's 12 and she's my size. I've been finding protecting myself difficult and trying not cross the line on my part to restrain her. So I agree, I think restraining is not a particularly great way to convey anything. It's very offensive to the person who's being constrained, and it feels terrible to the person who's doing the constraint. So in your case, Danielle, I do think it's important that you get outside help immediately and to set up some agreements about what is acceptable to do when you're angry and what is not, and what the consequences are for when you break those agreements. My sense is that a 12-year-old is angry and is acting violent because they feel out of control and they don't know what else to do. Obviously, hitting you and being violent with you is not okay, particularly now that she's your size. So we have to come up with some very clear agreements about what to do. I would say that if your daughter is violent and you feel unsafe, then you may want to call in a social worker to offer wraparound services. You could call law enforcement, although there are pros and cons of doing that. Jennifer asks, how do you handle kids who play sports competitively? My son plays baseball and loves it and often gets penalized for his inattention, his behavior, and not looking at the coaches when they talk. Well, I'm sorry to hear that, Jennifer. I think that sports, of course, is a great way to help kids with ADHD, because the more we're active, the more our brains have endorphins, and those endorphins bathe our brain and settle us down and calm us. I know that for me right now, I'm missing my bike riding and power walking and hiking, and I do find that that I am a little bit more irritable. So I worked for a long time with kids, and many of them have played competitive sports. I don't know if he takes medication or not. I assume that you've explained to his coaches that he has ADHD. Just because he's not looking at them doesn't mean he's not paying attention. It might be good to come up with some sort of fidget for him to use when people are talking. Fidget can awfully occupy that part of the brain that's wandering so that someone can pay attention. The difference between a fidget and a toy: a fidget occupies that part of the brain. You're not really paying attention to it. You're playing with that paper clip, but a toy you have to focus on. Also, I hope that when he plays baseball, that he has one of those positions where he's active. If he's in left field, that's going to be harder for him than if he's at first base or pitching or catching. Fatima, do you consider that preciosity is a kind of special need like ADHD? So I'm not sure what you mean by preciosity. If you're talking about precociousness, it would be great if you could explain that a little bit more. Holly, how do you increase the tolerance of academic work for older students? So much energy is spent preparing, building self-esteem that goes out of the plan, and many steps needed to complete a project. The layers can be exhausting. Absolutely, the layers are exhausting. Let's own that. Let's acknowledge it. One of the ways that we increase tolerance is through breaking down tasks into smaller pieces. So what happens is, when you have to concentrate for long periods of time, kids will lose attention and they'll lose their motivation. So we want to break it down. So we want to break it down in a couple ways. One, how long do people feel like they can concentrate before their mind starts to wander? That's the period of time that they work, and then they have a short break. And then they maybe can have a second period, and then perhaps a longer break. Add up those time. We want, so it's 20 minutes, a 5-minute break, 20 minutes, a 5-minute break, 20 minutes, and then we break for a half hour. Their brains need more time to integrate and not to be focusing on all of that concentration. It's exhausting for them as well. The other thing that you might want to do is work with kids to set up an order for doing work. Do they want to do something easy for them? Maybe that's math, maybe that's English that would help them kind of get in the groove of working and then do something harder, or do they like to do the hard thing off the bat and then do the easy thing as a reward because they've concentrated so hard? I think when we can play with the time and the structure, the order of the work, that can help as well. Dave, hi Dave. My daughters are 12 and 9 and steal food. I've tried everything, but they still aren't able to manage food. So are they stealing food because they're stealing things they're not supposed to eat, or are they stealing food because they're hungry? That would be an important differentiation. Please get back to me. Tom, I wish I knew this group when our 3 adopted children were younger. Now they're in their 20s. Keep up the great work. Thank you, Tom. Awesome. I appreciate that. Christy asks, should they be in a mainstream classroom? I don't see why kids with ADHD wouldn't be in a mainstream classroom if they don't need extra support. Some kids need an aide to help them stay on task. Some kids can in the classroom. Some kids can be in a general classroom, but they're in a supportive learning class once a day to help them do their homework, ask questions, so that when school's over, the school's over. I think it really depends on the severity of the executive functioning impairments and the coexisting learning disabilities or mental health issues. Fatima, um, uh, yes, sorry, precociousness or gifted children. Oh, okay. So what you're asking about are what we consider to be 2E kids, twice exceptional kids, kids who are super bright but also have ADHD, or kids who may have a difference in how they process verbal and nonverbal information. So your question is this a special need? I do believe that a lot of these children receive services for special needs. One of the things that we want to remember is that if your verbal IQ is very high, but your working memory is at an average level, your experience internally is a disconnect. So you understand concepts, you grasp, you can perform verbally. I mean, you grasp, you understand, and sometimes you can perform verbally, you can speak things, but you may not be able to hold things in your working memory, do a task, perform a complex task, and then get it out in the world. And so these kids often do need extra support. And so yes, I do think that it is a special need that requires attention. A lot of times what happens is the frustration for these kids is extremely high because they're very intelligent, but their processing speed is lower or their working memory isn't as strong as the way that they can, process verbal or nonverbal information. They walk around with a high level of frustration, and they're in upper level classes with people who have the same level of intelligence, but they can't perform at that level, and that often makes them feel bad about themselves. Dave, you said stealing food because it's there. Okay, so I see. So the food is there and they want it. So, I can't really say too much about that. I mean, I do think this is about impulse control. They see something, they want it. You might want to talk about what it's like to close the kitchen at a certain hour. If you have to lock the cupboards, perhaps, but that seems extreme. I think the question is why are they eating now? What is the need? What are they trying to fill inside of themselves? And what could they do instead of eating? Elizabeth, how do you best handle oppositional defiance disorder? I think I spoke about this before earlier. I think that when we talk about oppositional defiance disorder, we want to consider medication as well as family therapy or parent strategies. This is a dynamic. There's an unhealthy or a dynamic between parents and kids, or kids and teachers, that isn't working. So we have to work within those relationships to make changes. We can't rely on kids to just change these things on their own. Nicole asks, teacher has moved my daughter to the front row of the classroom already in 2 weeks of classes, 4th grade. Are there other tips to be used in a classroom to allow her to pay attention to the lesson and focus. She is very social and constantly looking around to see what others are doing and wanting to talk to them. Um, I think that that's important um, to uh, I'm sorry. So I think that, moving her to the front of the classroom is one way to do that. Um, it sounds like she wants to connect with other people. So are there opportunities in school to connect appropriately? And to redirect her towards those times. She may need a little signal. Sometimes kids need a signal when they're wandering off, and perhaps as much as saying her name, pulling the ear, touching the nose, something that isn't, overly, it doesn't grab everyone's attention, or to walk by the desk and maybe put a hand on the shoulder, something that can reorient her to what's happening right there. Christy, you want me to say yes or no? Um, yes or no? Should kids be in a mainstream classroom? I'm not going to say yes or no because I think it really depends on your child, what the accommodations are for your child, and what their educational needs are. So I will say sometimes. Lisa, um, thank you. Thank you for your lovely words, and I appreciate that. Shannon, Lisa says she's thanking me for my assistance. Shannon, my son has comorbidity, ADHD and anxiety, but bordering lately on ODD. He wakes up late at night and sneaks downstairs to eat junk food and watch TV shows that we do not find productive. So, okay, so first of all, waking up in the middle of the night and going downstairs and eating and doing things like that is not okay. It's not safe for your son, and it's very worrisome for you. So, this immediately requires meeting with your primary care provider, pediatrician, or a therapist. Waking up at night, wandering around the house, this require that you're going to need some kind of intervention. I don't think this is safe, and of course, it's really worrisome as a parent. So I would encourage you to get some help right away. Kids need, when it's time to go to bed, they need to go to bed and they need to stay in their rooms. You can't be worrying up all night that your child is wandering the house. Um, Kelly, how do I know if I'm enabling my son? Could you say a little bit more about that question? I'm not sure what you're asking. Karen, our ADHD son was separated from his friends in the classroom due to too much talking to them. He is very disappointed. Are there any other options for teachers to approach this situation? Well, I'm going to say yes, of course, but unfortunately, this is the solution that most teachers do. They separate kids with ADHD who are talking or who are engaging in behaviors that they find unproductive or disruptive, away from other kids, which of course sets up a vicious cycle of kids feeling abnormal. Considering, back to the question that someone asked earlier. Um, I think one of the things that can be helpful is setting up again a situation like, when is a time to talk, when isn't a time to talk, what is the signal that it's time to redirect. When kids are socially oriented, they're showing us that that's important to them and they're trying to develop those skills. How could they develop those skills differently? Do we want to have a signal, a post-it that you put down when it's time to reorient? I think there are other solutions rather than, isolating a child on the one hand. On the other hand, if your child can be in a different cluster of desks or in a different part of the room away from people who spur him to talk, that isn't necessarily as pejorative, as it were, as singling him out verbally repeatedly. So this could work. I think it really depends on the teacher and the situation. Sometimes kids with ADHD do well when it's a cluster of 4 desks because they see around that the other children are working, and the other children at the desk will say, hey, you know what? Shh, we're trying to get our work done. Jane Wong says, is medication usually long-term or can it be weaned off? I think that's completely individual. It depends if it's helping, if it's working. Um, we want to remember that ADHD is a biologically based disorder, and only 5 to 10% of kids who are diagnosed with ADHD outgrow it. And there's some question about whether kids actually outgrow ADHD or if they have learned how to accommodate it and adapt to having it. Then that has to do with the measures for assessing adult ADHD are not as strong as the measures for assessing ADHD in, in children and teens, excuse me. Um, um, so I think the weaning off is something that you have to work with your prescriber. And if the medication is working, I'm not sure what the benefit is of weaning off. Um, Lisa, it sounds like my son and is a 2E kid. 2D, I don't know what 2D is, but I'm thinking you mean 2E. E is an exceptional. Because he has a lot of frustration and anxiety about schoolwork. My daughter also sounds like it, but she doesn't show it as much, maybe because she's younger, age 6. I never thought of that. Yes, I noticed that Annie has posted something, an article in Attitude about twice exceptional signs with ADHD. Please check out that article. That would be really useful. And here are some additional ideas for a focus in the classroom. Shannon, he is no longer responding to cues or talking. Okay, so that Shannon, it sounds like you've got your hands full with your son, and so I really want to encourage you to try to get some help as soon as possible. Not responding to you, not talking, doing whatever he wants. That's not okay. That's not how a family works, and that's particularly not okay for a child or a teenager. If you're living under, if someone is living under your roof and you're still responsible for them, then they have to cooperate with what the house rules or guidelines are. So I would encourage you to get some help right away. In the meantime, and this is important, you want to look at the privileges that your son has and set up an agreement about whether he earns those privileges or not. Screens, which most kids want, is an earned privilege. You have to be, a lot of kids have to be on screen now for school, but they don't have to have gaming privileges. They don't have to have social media privileges. Those can be earned through cooperating. And I have one family I worked with where their child was wandering around at night. They installed a camera because they didn't know what to do, and they had to look at that camera, and that camera helped that child modify his behavior, even though it was sort of hard to stomach for all of the adults, myself and the parents. It did alter the behavior and improve cooperation. Um, Emer asks, hi, is melatonin safe for children? My son has difficulty going to sleep at night, and I've been advised to give him melatonin, thanks. So I'm not a physician, but I can say that I have a lot of clients who have ADHD, who take medication and have difficulty going to bed at night, and who don't take medication and have difficulty going to sleep at night, and they do take melatonin, and it's been helpful. I encourage you to consult with your physician about the dosage. Sherry asks, how do you best know if medication is effective or when to possibly change the dosage? This is a great question. My son is on Vyvanse um, and still struggling quite a bit with staying on task for online school. He's a huge procrastinator, and I'm not sure if he really knows either if his meds are helping or just not quite enough to be effective. Wow. Okay. So this is a really interesting question because unfortunately, with online school, people's attention is varied, and kids who were better able to pay attention in a in-person classroom are struggling right now with how to focus on screen. I mean, I'm hearing from all the kids in my practice and from many parents as well that 6 hours a day online, even with little 5-minute breaks and a period for lunch, is so much. It's just a lot. So I think the question is, what are you seeing? Are you seeing that the Vyvanse is assisting your son in attending to school and concentrating, or if he is less focused, not able to get down to work, then it might be time to consider perhaps a higher dosage and go. Most prescribers just go up a little bit, and then you see how that works. And so that would be, it's sort of a trial and error thing. And I know that's horrible to do as parents, and it's so frustrating. But that's how, these prescriptions for mental health issues or ADHD work. It's not an accurate science. We can't check, this is your level, so we've done a blood test and this is the amount you need. I'm sure we'll get there someday. We're just not there now. Shannon says he attends therapy once a week and we have a camera. So he's going to therapy, Shannon, but you as a family are not going to therapy. And that's what's needed right now, is you actually need to work with either that therapist for a second session a week, or find a separate therapist so he has his own person where you can do some family work. That seems really important. Kelly, homework in school regarding he's 10. All right, Kelly, I have to go back to where your question was. How do I know if I'm enabling my son? Homework in school. Okay, so I'm going to just go out on a limb here. Children's homework is their own. And if your child is not able to do the homework, then they're showing you that something isn't working. And that's where you have to go back to the school, because tenure at 10, because of the lag in how ADHD brains mature of about 3 years, in some ways he's 7. And at the end of a day of being online school or in school, his attention is spent. He's had to hold it together for a long time. And so if he's not able to do the work, then I think he might need a little bit less of it. What are some of the accommodations that would be useful to him? You're reading to him. Are you reading to him because he doesn't want to read himself? Are you reading to him because he is struggling with reading directions? Are you reading to him because he doesn't feel like doing it and you want him to do it? The latter it would be in the enabling category, although I certainly understand why you would do that. The first two require more intervention. Nicole says she uses melatonin and it's helpful. Elizabeth says there's no flexibility in public schools unless your kid is on an IEP. I agree. Although 504s can be helpful, which is one step down accommodations. I think one of the things that is happening right now for public schools is that parents have gone back and say, my child has a 504, that's not enough help. They now need an IEP, and schools are overwhelmed with this. Keep pressing forward as a parent. If your child is struggling a lot at home, then you need more support at school. Sherry says he is 16. Okay, so he would probably be able to tell you, 16-year-olds are relatively accurate reporters of, if the medication goes, if he starts taking the medication, if he notices a difference in his attention or his focus. And if he's not noticing a difference, then that's a good sign that he needs to go back and discuss his dose with the prescriber. Kathy says, my son is on 2 milligrams of Intuitive at 10 years for ODD, worked well for the past 1.5 years, but wondering if he needs an increased dose. What is the maximum dose? My mind goes to what will we do in the teen years? Are there meds that help with this? We see a TRBI therapist. So again, I'm not a physician, and I can't begin to tell you what the doses are for Intuitive. I encourage that you go back to your prescriber for this. And if you're concerned about what's coming down the pike in adolescence, start now with some family work to get those household guidelines in place, and to do that, set up a relationship between the have-tos and the want-tos, and what are logical consequences. This is very important. Susan, hi, nice to see you again. Thanks for joining. Norma, you are IMO. You are learning to cope. You are learning coping mechanisms to deal with it, but it's not seen as noticeable, so it surfaces here and there. Thank you. Kelly, I'm wondering if I'm micromanaging my son's homework. That's a great question to ask yourself. Here's the thing. If you are stepping up to beyond, checking in that the homework's done, or sitting with your son, for what I call family work time, where you're doing something and they're doing something, and, he can ask you a question. If you're doing more than that, if you're writing him to do the homework, if you are, if you're checking on the quality of the homework, then you might be doing too much. And that's a time to talk to his teacher and regroup. Cindy asks, what is your experience with a 14-year-old with ADHD, anxiety, and maybe ASD? Meds do not work for him. What would you suggest? So meds don't work for everybody. And I think that the important thing for a child who's 14 is a combination of therapy treatment. So a therapy where they have someone on their own if they feel like they want to talk to someone, and if not, family work. I can't emphasize enough, and I know I'm a family psychologist, so I come back to this tape a lot, but I can't emphasize enough the importance of working together to find solutions. I mean, there's been a number of studies about the ideal treatment for people with ADHD, and the number one thing is combination treatment, medication, and either family therapy or parent training that has a cognitive behavioral bent. Medication and behavioral therapy have both been found to be effective on their own, but not as effective as a combination. So in the case where someone cannot take medication, you want to lean into that therapy piece, that parent coaching as much as possible. But you want to include your 14-year-old. They're old enough now to have a say. In fact, I think young children need to have a say in what kinds of agreements you're making. You as the parent have the final say, of course, but we want to get some input from them because that increases their buy-in. Participation leads to agreements that are successful. Kayla asks, my kid doesn't know how to talk about his feelings. A lot of kids don't, and particularly kids with ADHD. He ends up saying, I don't want to talk about it, or I don't know. So we don't know what is bothering him, what is helping him. It makes it impossible to help him with schoolwork, sleep, angry expressions, anxiety. Also, will this be available to view when it ends? Yes, it's always on the Facebook page. So here's the thing. When kids are telling you they don't know, when you ask a kid with ADHD, why did you do this, or how are you feeling? And they're like, I don't know, they don't know. That's honest. What you want to do is take your observations about their behaviors, about their facial expressions, about the things they're telling you, and reflect those back to him. I notice that you're yelling a lot today. I'm wondering if something happened in school that set you off? Question mark. Or you could do I'm going to check in with you. I'm going to ask you a high and a low of every day. You can ask me, but I need to know things about your life because I'm your mom. I love you. I care about you, and I'm responsible for you. So you also might want to put up a plain old feeling chart you download from the internet, with people's faces and frustrated, disappointed, and say, okay, if you can't talk about it, could you point to it? Ugh, why are you treating me like such a child? Because this is a skill that you're still learning, and I'm going to help you with it. Kelly, I feel like I have to sit with my 10-year-old every minute that he is working on schoolwork because he's not retaining what he's reading, or he'll just rush through and say he doesn't care. I don't want him to fail. He's very smart, but school frustrates him in a big way. Okay, so Kelly, this confirms my suspicion, which is that your son is being asked to do things that he does not have the skills for yet. Not the intellectual skills, but the social, emotional, psychological skills. And so you need to go back to the teacher and say, when he's not in school, I have to sit with him to make sure he does his homework. So figure out what is the minimum amount of time that he has to do his homework. What's the minimum amount of assignments? And start with that. Break down schoolwork into smaller chunks. If it's a 5-minute chunk, that's okay. We want him to start to feel like he's accomplishing things and he has success, that he's not dreading the homework, that it's something that's manageable. Thanks, Annie, for that great link. Lane asks, Jennifer, medication is effective? You should need to add a bunch of other meds. That's not how it works. My kids take an extended dose of their medication before school. They have a short acting dose when they can that dose they can take in the afternoon. But we choose if and when that's taken based on the afternoon. That's really important, Lane. Thank you. 5 years of medication for my oldest and never added anything. I have two on meds and it's been a godsend for both, and we wouldn't change anything. It gives my kids the opportunity to be their awesome selves without all the noise. Lane, that's beautifully said. Thank you. That's the idea, that the medication turns the noise down so kids can really express and be with who they are inside. Um, you're welcome, Amer. You're welcome, Karen. Kayla says he's 10. Thank you, Kayla. Let's see, Fatima, what about vitamins, minerals, and omega-3 cocktails instead of making medication? Can we see improvements? Yes, you can. And Fatima, what I want to encourage you to do is look in the Attitude Mag library. There's a lot of things on, alternatives to medication, a lot of articles on alternative medications that would be helpful to you. Um, you're welcome, Kathy. You're welcome, Kelly. Let's see, I'm going to take one or two more questions. Kayla, additionally, questions spark him into anxiety. He automatically thinks he's being blamed and defensive. We all end up having to start questions with, "You're not in trouble." Is that a normal response? Yes. Shame is huge. Shame is huge. You want to think about that. I worked with a 9-year-old who said, "I don't know why you all adults think there's such a thing as positive feedback. There is no positive feedback. It's all negative all the time." And that's the framework, although it's really sad, that you want to approach your son with, because that's what he's thinking about. So to be able to have one or two phrases to lower his anxiety: "You're not in trouble, there's nothing wrong, blah, blah, blah." And I would you ask any questions based on behaviors, words, or facial expressions that he's showing you. Harlan, I want a voice from my childhood. Thank you, Harlan, for sharing. Hold on. And state that it seems very difficult for us children to be truly honest with our feelings. Absolutely. The only feelings that seem to cause reactions are the negative ones, and the first response seems to make it go away. That speaks to self-limiting sharing, regardless of actual motives for parents. Yes, Harlan. Yes, yes. We're talking about shame. I think shame is a huge factor for everybody who lives with ADHD, because of the messages that people who live with ADHD get from early on, ways that they're maybe missing something socially, ways that they're speaking in school or talking or moving or doing something that they shouldn't be doing, how they could do it differently or better. And so what happens is a vigilance builds up, that a kind of like, when am I going to do the next thing that I know wasn't, like, I don't even know, it's not even in my control, and I'm going to get negative feedback for, right? And so there is both the anxiety that vigilance turns into, and the co-occurring shame. They just merge together. And so if the feeling is, I need to make these problems go away, is there some level at which people feel, and I think they do, I need to go away, I'm not worthy. And so that's part of why you're getting that reaction. And this is the last question from Jennifer that I'm going to take. What are some great talking points to give family members who think your child needs more punishment, discipline, rather than having a disability? For example, they feel that he should be able to sit for 30 minutes at his age. They feel he doesn't listen, interrupts, and should be able to go to sleep quickly rather than taking a long time. Okay, you know what I want to say to these people? I want to say to these people, go read a book about ADHD. Go on Attitude and learn about what ADHD is. If I have to say so without being shamelessly self-promoting, or maybe being I am, read my book. Because what you're going to read in that book is what kids are actually struggling with. You know, the expectation of someone to sit for 30 minutes is unrealistic for an elementary school student with ADHD. What's realistic is sitting between 5 and 20 minutes. That's it. And middle school, maybe we get 20 to 40 minutes, maybe 15 to 30, perhaps, depending on the kid. And high school, we're going to see more like perhaps 30 minutes and maybe up to an hour if they're hyper focusing. So this kind of mentality, the discipline, the punishment, what I want you to say to those family members is punishment doesn't teach skills. Punishment teaches fear. Punishment teaches shame. We want to teach kids the skills they need so they can be independent, successful adults who feel competent. And I have no, I mean, I'm very passionate about this, very, very passionate. And I don't have a lot of patience for when family members tell families, parents who are living with ADHD 24/7 what they should do differently. I know they're coming from a good place, that they care, but how it makes you feel as a parent is like you're failing. Norma, will I do something like this for ADHD adults? It would be greatly appreciated. I will talk to Attitude and ask them. Um, Thank you so much for joining me today. I really appreciate it. You have asked some terrific questions. I want to remind you to please go to my website, www.drsharonsaline. Sign up for my weekly email where I write a blog that's just for you on what it's like to live, parent, and face each day with ADHD. And like my Facebook page. It's where I post all kinds of things that I'm doing, I'm interested in, articles I like. It's at drsharonsaline.com. Have a wonderful day. Thank you.